Good morning, guys. Well, at least it's morning for me. I'm very excited. I am starting a new YouTube series based on my personal experiences and things I've learned as not only a provider, a nurse, but also a patient. So, for this first series, I want to talk about choosing a surgeon. My thought is this process or each episode of the series is going to be around 5 to 10 minutes. I have not even recorded myself through doing this presentation yet, so we'll see how close I get. But that is my intention. So I'm going to go ahead and share my screen and we'll jump right into that. If you want background on my experience, please refer to some of my other videos on this channel. Okay, we're going to move that up there. So I'm calling this series a Silver Lining Series, transforming my experience into your empowerment. And these are my recommendations based on personal experience as a patient and a nurse. Episode 1, choosing your surgeon. I do want to give a bit of a disclaimer here. These recommendations are based on my own personal experiences as a nurse and a patient. It's also based on my discussions with other patients and discussions with healthcare professionals. This presentation is not comprehensive, nor is it in support of any specific provider or surgery or treatment plan. It is meant as a tool for you, the patient, in determining your own treatment plan. Okay, so today we're going to talk about the things that I have found are most important in determining your care team. The first is knowing your values. The second is knowing your goals. Thirdly, what are your resources? Fourth, what are other patients saying? Five, what is the surgeon saying or the provider? And six, what does your intuition say? Okay, so the first is what are your values? Values are kind of an interesting thing, and I think it's very important to evaluate this first as you start your journey. There are actually free online tests that you can do if you want to take like an official test to see what your values are, but it could be a little bit more simple. And I'm going to give a few illustrations of some stories to give you an example of why it matters. So the first is I'm a nurse at a pediatric hospital, and I was caring for a patient who was about elementary school age who still wore diapers because he was incontinent and developmentally delayed. And his mom, I had just come onto my shift, and his mom had said she was going downstairs to get breakfast. So she went downstairs. I came in to do my first assessment and vitals for the day, and I noticed that his diaper was dirty. So I changed him. When the mom got back, she was upset because I changed the diaper and she wanted to do it. So for her, it was very important that she was involved in all of the aspects of her son's care. So I apologized. We made sure we set the scene for the rest of the day and we moved on. Well, later that week, I was caring for a different patient and similar scenario happened. The caregiver stepped off the unit for a little while and I noticed that the child had a dirty diaper. This time I did not change the diaper because I did not want to upset the caregiver. And when that person returned, they could tell the diaper had been on for a while because it was very full, and they were upset that I had not changed the diaper and that their child was sitting in their own pee and poop for an extended period of time, or at least longer than they felt was supposed to happen. So in this scenario, the first caregiver had the priority of being engaged and involved in all aspects of the care, even if it meant a little bit of a delay in the care her child received. She felt that was worth it. And then in the second scenario, the caregiver was prioritizing the timeliness of the care that her child received and was not as interested in being a part of it so much as it happening on a timely schedule. So, this is just an example of how important it is to talk with your care team at the beginning. Firstly, to know your own values, and maybe look back and reflect on some situations that you've encountered where you felt upset or you felt heard, and what value was amplified in those moments. Another example of something that a provider can say that sometimes upsets the patient and other times empowers the patient, and that's when the provider says, "What do you think?" or "What do you want to do?" I have heard some patients and families say, well, I don't know, you're the expert. And it actually makes them feel um, like the provider maybe isn't the person they should go with, or maybe they don't know what they're doing. On the other hand, you have families and caregivers and patients that love that question because they get to be an active participant in their treatment plan. Another thing to address with your care team is how, like, if you feel you have past medical trauma, which a lot of people in at least my population do because we have had multiple different failed treatment plans, multiple incorrect diagnoses. And as those scenarios build, it subtracts from the trust in the team and gives you anxiety about trusting in the future. So I wanted to specifically mention that because different providers handle that differently. Another scenario I've noticed frequently in the healthcare realm is the timeliness of the provider. Some offices or are typically known for running behind, and some patients feel like that is insulting or offensive or disrespectful. Um, Other families and patients feel like that is valuable because this shows that the provider is dedicating and spending all of the time that the person needs who is currently in his office. And if they slotted that appointment to take 30 minutes, but it took 45 minutes, and that provider doesn't rush you out the door, but spends that time with you to answer all your questions and make sure you've been heard, that's going to make them late for the next appointment. So that's another example, the timeliness. Does that matter to you, or would you rather like wait and know that you're going to be behind, or that the provider is going to be behind, and know that when it's your turn, you're going to be heard? Next, what are your goals? Some people, they want to do the least invasive thing possible and hope that it works. And then if it doesn't work, do another surgery later. Other people want to do like the big one and done. Like, could this work? Could it not work? And if this least invasive one might not work, they want to advance to the full one and done scenario. Other goals, and this is specific for my situation or my population with the jaw and the face structure. Um, are you more focused on function or aesthetics, which is like how it looks? Just knowing that. And then are you more interested in more of I hesitate to say quick fix because none of this is quick, but a faster timeline or a more meticulous step-by-step timeline? So an example of this would be I heard a provider say one time that in our case, again, most or many times it's advised to do braces or orthodontics ahead of the surgery to help prepare your mouth fully for this surgery. He stated that the patient did not want to do braces, that she wanted quicker results than that. And so he went ahead and did her joint surgery without the braces. And he said he didn't get the outcomes that he was hoping for, but she was happy. And so that's what he did. So there's an example of whose goals, like what your goals are, and kind of aligning those with your treatment plans. The next is looking at your resources. So the first is most obviously money, especially in this world. A lot of the providers aren't within network or don't take insurance. And so, do you have the financial resources to raise money, save, take out loans, or pay for these out-of-pocket costs? That is something that's important. Another thing to consider is transportation. Is this provider someone that you can access frequently, or when you need them urgently, in an unplanned way? So this could mean the frequent flights out to the provider or the drive time, either one. Another thing to consider is your disability insurance, and do you have it? Because part of the healing process and thus the outcomes of this surgery depend on your ability to invest in your recovery. So, are you rushing back into work, or is your employer going to be able to provide, like, set the stage for the healing that you need? Along with that are time constraints. So some people, if you're in a new job, you have to wait 1 year for your benefits to kick in. Or for people that are starting a family or pregnant, that impacts your ability to have anesthesia and take all the medications required. And then last is caregiver support. So are the people who are around you able to help in all the ways that you need, which at the beginning is in every way, and just kind of coordinating your schedule with theirs. This topic is probably the most overwhelming. And what I will say about this topic is um, don't immediately write an option off because you think you don't have the resources for it. I didn't know I was going to cry. It's really, really hard to ask for help. Um, Oftentimes people want to. And so being vulnerable about what you need. So say you feel that you want to go with a provider that is going to require more resource giving than another. Um, Explaining to your loved ones and the people around you why and asking for help is really hard. Sometimes it's a no, and we do have to consider ourselves as whole person. Like, um, if you're going to pay so much money to your provider that you're going to lose your house. Well, that's probably not an outcome that you can stomach. Um, but at the same time, if you choose a provider you don't want to go with because they're in network and then you have poor outcomes and have to have another surgery later, which isn't always the thing that happens, but that's a scenario I've heard. Um, would it be worth it to have investigated at the beginning and see if you had resources that maybe you didn't realize you had, or people that wanted to help you and we didn't give them the opportunity to help us. The next thing is, what are other patients saying? So, firstly, I would ask, what are the positive outcomes of those patients? And there's different ways of connecting with patients. The first is you can ask your provider, do you have any previous patients that are willing to talk to me? A lot of people will say yes, or they have that list of people they'll send to. Another thing you can do is search for Facebook groups or other social media groups that have been created for our population. That's where I've made the majority of my connections, and they've been so life-giving. Um, Another thing to ask other patients of your surgeon or provider specifically is, what mistakes did they make? And it's not did they make mistakes. Every healthcare professional makes mistakes and learns and grows. That is not necessarily a bad thing. But it is something to ask, what mistakes were made so that you can assess the current level of expertise and knowledge of your provider. And then how did they handle those mistakes? Were they accountable? Did they stick with the patient? Did they deny them? Did they say they were, I've heard stories of the provider saying the patient was making it up. So the how the mistakes were handled are just as important as what mistakes were made. And then I think this is a really important thing to note. I've had a lot of people mention, and myself included, I noticed this. I got a lot of anxiety reading some of the posts in the social media groups about bad outcomes, and it made me scared. And had I listened to that fear, I would not have chosen a surgery that literally saved my life. So, what I started asking myself was, has anyone with my specific diagnosis and my specific surgeon or provider posted about bad outcomes? Those are the voices you want to amplify because you're kind of narrowing down who is in my like sphere of similar situation. And once you find those people, ask what the complications were specifically. Then ask yourself, with those complications, what went wrong? Did they have additional diagnoses that complicated the situation? What was their lifestyle and mindset during their pre-op, their surgery, and their post-op? And what was their follow-up plan? Did they do their rehab as they should have? Did they follow the surgeon or provider instructions? And I am by no means putting the fault or the blame of complications on patients by saying all of this. What I am saying is we as patients are just need to be held just as accountable for our outcomes as our surgeons and our providers need to be. The surgeons get us to the point where we can heal, but we are by no means healed when we walk out of the operating room, or actually when we're wheeled out of the operating room. It is our job from there to start the healing journey. Now, sometimes our surgeons have not set us up for success. Other times they have, but that success is not immediately there the minute you are out of the operating room. It is a journey. So don't let bad stories scare you up front. Dig into them more and learn from them. The next, what is your surgeon saying or the surgeon you're considering? My biggest question when I was searching for a surgeon was their level of expertise, but I had no idea how to determine that. And I felt really conflicted because I had an option for a provider that was in network that would have cost $4,000 total out of pocket, only $4,000, and it would have been local. So all of the additional resources that I needed for housing out of state and travel, it eliminated so many complications or dynamics to go with that in-network provider. but I felt so unsure about his level of expertise. I had I had heard great outcomes from him, but I just didn't know. So I spoke with a coworker and friend who's a physician who's had multiple surgeries himself, and I explained my conundrum and I asked, "How do I assess expertise?" And he said something that was so liberating and powerful for me because he gave me psychological permission to go with my gut. And he said, the provider who is an expert is the one who, in their professional hours, spends the majority of their time doing the service that you need from them. And that was amazing for me. I was like, okay, like I wanted the provider who wasn't doing my surgery a few times a year for the last 10, 15 years. I thought that was perhaps an expert, but according to this diagnosis, he said or this description, it's the person who spends the majority of their professional hours doing the service that you need from them. And that was just so liberating for me. And I have so much gratitude to him to helping me figure that out. I also was very intentional about asking my surgeon for their post-op data. How many revisions had they had to do? Did they have post-op infections? What was the nerve damage rate after these surgeries? What is their pain management plan? What was the function of orthodontics in their treatment plan? Do they focus on airway as far as doing the virtual surgery planning session? What is their pain management plan? What is their infection prevention method post-op or after surgery? What does their follow-up care look like? And do they give their patients their personal contact information? All of those things really mattered to me. And then, does their treatment plan align with evidence? This is a hard one because evidence involves you as the patient going out and doing research into medical journals. It's called evidence-based practice, is the terminology we use in healthcare. And what that means is research has been done with patients. It's not just theoretical idea, it's true. Like we've done the research with patients in these scenarios and seen their outcomes, and we're publishing this data. There's two ways that you, as the patient, as a general person in the world, can get this information. Because a lot of times you need subscriptions to medical journals or medical libraries, which you can do. But I found some other options. Sorry. The first is you can ask your surgeon for research articles, kind of outlining his or her recommendations and treatment plans. For example, some surgeons use stock joints for the jaw replacement. Others use custom joints. And then what kind of joint they're using is important. Some surgeons are saying that it's not necessary to do metal allergy testing. Others say that it's very important, or at least it's something they recommend. By the way, my own personal opinion, do the metal allergy testing because going through this experience once was hell. I can't imagine having to do it again because the implant they put in my body was nickel based and I was allergic to it, which in my case, I was allergic to nickel. So it's added steps at the beginning to get the all titanium joints, but in my opinion, it's worth it. This goes back to your values, though. Are you wanting to kind of move this process along more quickly, or would you like to invest more time in research from the beginning, which then draws out this treatment plan because you have to get FDA approval and institutional review board approval to get the all titanium joints? Side note done. So these are all some variations in treatment plans that can be really overwhelming for patients because when you have people who are experts in a field saying different things, that makes it very, very challenging to know who to trust. So getting your hands on the data and the research is very important. Other than asking your surgeon for the articles, you can also search a website called PubMed. We're going to link this here. I really hope you guys can hear it. If for some reason this video doesn't play audio when I click on this link, then I have uploaded this video separately to my YouTube channel. Just skip forward the silence part of this and go watch it on the YouTube channel. It's under my shorts. But we'll see if this link works and you get the audio. I have no way to know. So navigating PubMed can be hard. So here's an intro. You'll go in there and type your search. And in my case, it would be TMJ joint replacement. You can go through and start searching through the articles. You'll want to make sure and put your filter for free full text, unless you want to pay for a subscription. At that point, you can start scrolling down, looking for articles that you're interested in and that align with your diagnosis and the recommended treatment plan. Find one, and then the link will just take you to the abstract and some basic information regarding the study. If you want to read the full text, which is really the whole point, select full text links, and it will take you to the whole journal article. From there, you can read the entire article. Sometimes it can be overwhelming. It just depends on how deep you want to get into it. So as you scroll through the article, it gives a lot of science stuff that sometimes doesn't make sense regarding scientific method, and it's outlined based on how the Institutional Review Board and scientific method has studies conducted. Sometimes the tables and graphs can be hard to understand, but if I don't read the entire thing, I'll go down to the conclusions or results section, which is where we are now, and you can see some tables and some summaries of their studies. So here's the discussion afterwards, which also kind of summarizes the study evidence or the findings without having to dig through like all of it with them. And at the very end, there's the conclusion section, which is a summarized paragraph, which will be the most helpful to read. So navigating PubMed can be hard. Okay, hopefully that worked for you. If you couldn't hear, go to that YouTube link under my channel and watch it. And sorry to waste a minute and 30 seconds of this presentation. The next one is, and the last one is, what does your intuition say? And I wanted to give your inner voice power in this situation. What do you want? What are you feeling? And one thing I've learned about intuition is that intuition is learned and earned. It is not innate. Exposure is key. So over time, you'll start to work that muscle and kind of grow that in you. Talking to surgeons, get second opinions. I definitely recommend getting more than one opinion from a surgeon before you move into this process. Compare and contrast their recommendations. Do your research by talking to patients and looking up research articles. All of these things are going to grow that intuition in you. And then we are like mind, body, spirit. So go with your mind first. Ask yourself, what does the evidence show? What is my surgeon saying? And then your heart, what do I feel? Because you're going to feel a connection with one of the providers, and that is really valid. So listen to that. I think the one thing that I found as a barrier when I was listening to my intuition was I didn't know when it was my intuition talking and when it was anxiety talking, which is a very real thing. And so, one thing that I personally did to combat that was don't make any quick decisions. I found that if I sat on a decision for a while, I could parse through the anxiety. Because my anxiety didn't stay heightened the whole time, but my intuition would. And so, like, the anxiety kind of ebbs and flows. I would really allow myself to have time to think through what I wanted to do and the decisions that I had in front of me and listen to that. The other thing is 100% I got a therapist, not a physical therapist, but like a mental health therapist to help me with this process. Because a lot of this is personal growth. And I mean, knowing your values, knowing your goals, all of that has to do with therapy. While I'm talking about therapy, some employers will provide free therapy for a certain number of sessions a year. That's the method that I went with because Lord knows we're spending enough money already. And I do know it's another appointment, and I had so much appointment fatigue, but this is the journey we have. So the therapist helped a lot with kind of parsing through that as well. Um, and then lastly was really just trusting myself. You've done research. Like, I want to applaud you for spending time. This is the first step. Spending time doing research. That's what brought you here. That research is really going to fuel your ambition and really help you decide what your intuition is. So, thank you for coming to this page. And I am so grateful that I was able to provide this presentation based on my experience. My journey has been really hard. And one of the ways that I have felt fulfilled through this journey is finding the silver lining in it, which for me is empowering you through my experiences. So I hope you found this presentation helpful. I would love to have dialogue about it. Please share other priorities or things that you feel I didn't include in this presentation that could be part of the discussion. And as always, I am available on Facebook on my page From Fear to Freedom, my journey before, during, and after TMJ replacement, and then also this YouTube channel. So please reach out. I am so grateful for this community and I really appreciate you guys.